CNA Aspiration Precautions Positioning. Welcome to the quiz. Question 1. You are collecting a routine urine specimen. What is the correct procedure to ensure an uncontaminated sample? Option A. Have the resident void into a clean, dry collection container, like a hat placed in the toilet, then pour the urine from the container into the specimen cup, filling it to the required line. Do not let the cup touch the container. Option B. Take a sample from the urine already present in the bedside commode to avoid bothering the resident to provide another sample. Option C. Ask the resident to urinate directly into a sterile specimen cup, holding it in place. Option D. Send the entire bedpan with urine to the lab so they can collect the sample themselves. The answer is A. Using a clean collection container and pouring into the specimen cup minimizes contamination. Option A is correct because using a clean collection container, hat, and then pouring into the specimen cup minimizes contamination. Option B is incorrect because urine from a commode may be contaminated with water or cleaner residue. Option C is incorrect because it's difficult for the resident to aim directly into a small cup and it may contaminate the outside. Option D is incorrect because sending a whole bedpan is impractical and unhygienic. Question 2. A resident who is verbally abusive and has a history of hitting caregivers during care becomes agitated while you are helping them dress. What defense mechanism should you use first to protect yourself and de-escalate the situation? Option A. Call for help to hold the resident still while you finish dressing them, as the task must be completed. Option B. Stop the task immediately, step back to a safe distance, and give them space to calm down. Use a calm, reassuring voice and avoid making sudden movements. Do not turn your back on them. Option C. Continue with the task as quickly as possible to get it over with, ignoring the verbal abuse and attempts to hit. Option D. Restrain their hands gently but firmly to prevent them from hitting you, and continue dressing them quickly. The answer is B. De-escalation by creating space is the first step when a resident becomes agitated. Option A is incorrect because holding them down is not appropriate and may be considered abuse. Option B is correct because de-escalation is the first step. Removing yourself from immediate danger and giving the resident space can reduce agitation. Option C is incorrect because continuing risks injury. Option D is incorrect because restraining can escalate and is not allowed without order. Question 3. When providing mouth care to a resident who has their own natural teeth, what is the most important reason for brushing at a 45-degree angle to the gums? Option A. It prevents the toothbrush from slipping on the teeth and ensures a thorough cleaning. Option B. It allows the toothbrush bristles to reach under the gum line to remove plaque and bacteria, which is essential for preventing gum disease, gingivitis, and tooth decay. Option C. It is the most comfortable position for the resident and prevents gum irritation. Option D. It is the only way to effectively reach the back molars and clean the chewing surfaces. The answer is B. The 45-degree angle targets plaque at the gum line. Option A is not accurate. Option B is correct because the 45-degree angle directs bristles into the sulcus, the space between tooth and gum, where plaque accumulates. Option C is not the primary reason. Option D is not the main purpose. Remember, we can take your CNA exam for you, remotely and undetected, and with 85% score guaranteed. No fails, no upfront fees, no deposit, pay only after results. Message us via number in bio to schedule your session. Question 4. A resident tells you they haven't had a bowel movement in 4 days and are feeling uncomfortable and bloated. What should you do? Option A. Encourage them to drink more water and move around if able, and report their complaint and the number of days since their last BM to the nurse promptly. The nurse needs to assess and order any interventions. Option B. Give them a cup of prune juice and wait to see if it works, documenting the intervention and outcome. Option C. Tell them it's normal to skip a few days, especially at their age, and not to worry about it. Option D. Immediately give them a suppository from the supply closet, as this is a common CNA intervention for constipation. The answer is A. Constipation requires nurse assessment before intervention. Option A is correct because constipation requires nurse assessment before any intervention. The nurse may need to check for impaction or order a suppository. Option B is incorrect because prune juice may not be appropriate without knowing the cause. Option C is incorrect because 4 days without a BM is not normal and can cause discomfort and complications. Option D is incorrect because suppositories require an order. Question 5. You are assisting a resident who uses a cane to walk. The resident is unsteady. Where should you position yourself to ensure maximum safety? Option A, on the resident's stronger side, holding their arm to provide support and guidance. Option B, directly in front of the resident, walking backward and watching their feet to ensure proper placement. Option C, directly behind the resident with your hands on their hips, ready to catch them if they fall backward. Option D, on the resident's weaker side, approximately 1 step behind them, and hold the gait belt securely at their back. This allows you to support them if they start to fall without impeding the cane's use on the stronger side. The answer is D. Positioning on the weaker side provides support where it's most needed. Option A is incorrect because supporting the strong side may not prevent a fall to the weak side. Option B is incorrect because walking backward is awkward and you can't see behind you. Option C is incorrect because being behind does not allow you to catch a forward fall. Option D is correct because standing on the weaker side allows you to support the side most likely to give way, and holding the gait belt gives you control. Question 6. A resident with a gastrostomy tube, PG tube, is receiving a tube feeding. The resident begins to vomit. What is your immediate action? Option A. Slow the feeding rate down by half and continue to monitor the resident for further vomiting. Option B. Stop the feeding immediately by clamping or holding the tubing and turn the resident onto their side to prevent aspiration. Then, call the nurse immediately. Option C. Continue the feeding, as vomiting can be a side effect of tube feeding, and it will likely pass. Raise the head of the bed higher. Option D. Call the nurse to see if you should continue the feeding or stop it, while continuing to observe the resident. The answer is B. Stopping the feeding and positioning to prevent aspiration is critical. Option A is incorrect because slowing may not prevent aspiration if vomiting occurs. Option B is correct because stopping the feeding prevents more formula from entering the stomach, and turning the resident on their side helps drain vomit and prevent aspiration. Option C is incorrect because continuing the feeding can worsen vomiting and aspiration risk. Option D is incorrect because waiting to call the nurse delays critical action. Great job! Don't forget to subscribe. Bye!